very good because these are bodybuilding foods, and body requires more bodybuilding foods because of repairs which are required during treatment. Second thing,
cancer affects millions of people worldwide, and for many, the diagnosis comes with fear, confusion, and an overwhelming number of questions. One of the most common questions patients and families ask is this: what can I do to support my body during cancer treatment? While nutrition cannot cure cancer, what you eat can play an important role in supporting the body during therapy, helping maintain strength, manage side effects, and improve overall quality of life. Today, we are going to explore how nutrition supports the body during cancer therapy, using clear science, real data, and practical understanding, without exaggeration, fear, or false hope. A simple truth about cancer and nutrition. Cancer is not one single disease. It is a collection of more than 200 different conditions, each behaving differently depending on the type of cancer, its stage, genetics, and the individual affected. Because of this, there is no single anti-cancer diet that works for everyone. However, decades of research show that proper nutrition helps the body tolerate treatment better, recover more effectively, and maintain essential functions during therapy, such as chemotherapy, radiation, surgery, immunotherapy, or targeted treatments. Nutrition during cancer treatment is not about restriction or perfection. It is about supporting the body's needs during an extremely demanding time. Why cancer therapy challenges? The body cancer treatments are designed to destroy rapidly dividing cancer cells. Unfortunately, many healthy cells in the body, such as those in the digestive system, bone marrow, hair follicles, and immune system, also divide rapidly. This is why treatments can cause side effects such as fatigue, nausea, appetite loss, mouth sores, digestive changes, and weakened immunity. From a biological standpoint, the body is under stress during treatment. It needs more energy, more protein, and more micronutrients to repair tissues, fight infections, and maintain muscle mass. Without adequate nutrition, patients may experience unintentional weight loss, muscle wasting, delayed healing, and increased treatment complications. This is where nutrition becomes a form of supportive care, not a cure, but an essential partner to medical treatment. The role of calories and energy balance. One of the first nutritional challenges during cancer therapy is maintaining adequate calorie intake. Many patients experience a reduced appetite due to nausea, taste changes, early fullness, or emotional stress. At the same time, the body may require more energy than usual because of inflammation, tissue repair, and immune activity. When the body does not receive enough calories, it may begin breaking down muscle tissue for energy. This loss of muscle, known as cancer-related muscle wasting, has been associated with poorer outcomes, increased fatigue, and reduced tolerance to treatment. Nutrition support aims to provide enough calories to prevent excessive weight loss, preserve muscle mass, maintain strength and functional ability. This does not mean eating large amounts of unhealthy food. It means strategic nourishment, often through smaller, more frequent meals that are easier to tolerate. A critical building block. During treatment, protein plays a central role during cancer therapy. It is essential for repairing tissues damaged by treatment, supporting immune function, maintaining muscle mass, producing enzymes and hormones. Research consistently shows that cancer patients often require more protein than healthy individuals, especially during active treatment. Inadequate protein intake can contribute to weakness, delayed recovery, and increased susceptibility to infection. Sources of protein can include lean meats and poultry, fish eggs, dairy products, legumes and beans, soy products, nuts, and seeds. For patients struggling with appetite, softer protein sources or liquid nutrition may be recommended by healthcare professionals. Fuel for the body and brain carbohydrates are often misunderstood, especially in online cancer discussions. Scientifically, carbohydrates are the body's primary source of energy, especially for the brain and nervous system. During treatment, carbohydrates help prevent fatigue and support daily functioning. Whole, minimally processed carbohydrates, such as fruits, vegetables, whole grains, and legumes, also provide fiber, vitamins, minerals, and protective plant compounds. These nutrients support digestive health and overall metabolic balance. There is no credible scientific evidence that eliminating carbohydrates cures cancer. Nutrition recommendations focus instead on balance, quality, and individual tolerance. Healthy fats and their supportive role. Fats are an important source of concentrated energy and help the body absorb fat-soluble vitamins such as A, D, E, and K. Certain fats, particularly unsaturated fats, play a role in reducing inflammation and supporting cardiovascular health. Healthy fat sources include olive oil, avocados, nuts, and seeds, fatty fish such as salmon. For patients experiencing weight loss, fats can be especially useful because they provide more calories in smaller volumes of food, which may be easier to consume. Vitamins and minerals. Matter. Vitamins and minerals are essential for nearly every biological process in the body, including immune function, wound healing, oxygen transport, and nerve signaling. During cancer therapy, the demand for certain micronutrients may increase, while intake may decrease due to appetite changes. A varied diet rich in fruits, vegetables, whole grains, and protein sources usually provides adequate micronutrients. However, high-dose supplements should not be taken without medical supervision, as some may interfere with treatment effectiveness. Oncology nutrition focuses on meeting needs safely, often through food first, and supplements only when medically appropriate. Often overlooked, always essential. Hydration plays a crucial role during cancer therapy. Dehydration can worsen fatigue, constipation, kidney stress, and confusion. Some treatments increase fluid loss through vomiting, diarrhea, or fever, making hydration even more important. Water, herbal teas, broths, and hydrating foods can all contribute to fluid intake. For patients who struggle with plain water, flavored or temperature-adjusted options may help. Maintaining hydration supports circulation, nutrient transport, and waste removal, basic but vital processes during treatment. Managing common treatment. Side effects with nutrition. One of the most practical roles of nutrition during cancer therapy is helping manage side effects. While food cannot eliminate side effects entirely, strategic choices can reduce discomfort and improve daily functioning. For nausea, bland foods, small meals, and avoiding strong odors may help. For mouth sores, soft, cool foods can reduce irritation. For constipation or diarrhea, fiber intake may be adjusted carefully under guidance. For taste changes, experimenting with textures and seasonings can make eating more enjoyable. Nutrition is personalized, not one size fits all. What works for one patient may not work for another. Nutrition, immunity, and infection. Risk cancer treatments can suppress immune function, increasing the risk of infection. Adequate nutrition supports immune cells by providing the energy and nutrients they need to function properly. Protein, vitamins such as A, C, D, and minerals like zinc and iron all play roles in immune health. However, no food or supplement can boost immunity beyond its natural capacity. Nutrition helps maintain normal immune function, which is especially important during treatment. Food safety also becomes critical. Proper food handling, cooking, and storage reduce the risk of foodborne illness when immunity is compromised. integrative oncology and nutrition support. Modern cancer care increasingly recognizes the importance of integrative oncology, combining conventional medical treatment with evidence-based supportive therapies. Nutrition is a central part of this approach. Registered dietitians specializing in oncology help assess individual needs, adjust dietary plans throughout treatment, and provide realistic guidance that adapts as the patient's condition changes. This integration ensures that nutrition supports medical treatment rather than conflicting with it. Hope through science, not hype. It is important to address a reality many patients face: online misinformation. Claims of cancer-curing diets or extreme food restrictions are not supported by credible scientific evidence and can sometimes cause harm. True hope comes from science-based care, personalized treatment, and supportive strategies like nutrition that help patients feel stronger and more resilient during therapy. But it plays a meaningful role in supporting the body, preserving strength, and improving daily life during treatment. Every patient is different, every journey is unique, and nutrition, when guided by science and compassion, can be a powerful form of care. If you found this explanation helpful, remember that knowledge empowers patients and families. Understanding how nutrition supports the body during cancer therapy can help people make informed, safer decisions alongside their medical team. If you want more science-based, compassionate, and educational content about cancer, including nutrition, treatment explanations, and supportive care strategies, our goal is to inform, support, and bring clarity, without fear, without false promises, and always grounded in real science. Thank you for watching, and we look forward to supporting you with future videos.